Let's change slides here. Okay, so what is Medicare? Medicare is a jointly funded healthcare program funded by the federal government. Medicare was implemented back in 1966 under the Social Security Administration and under President Lyndon Johnson's administration, and is now currently administered by the Centers for Medicare and Medicaid Services, otherwise known as CMS. Medicare is also one of the largest healthcare plans in the United States. And as of the year 2019, so as of last year, 61 million people were enrolled in the program. Okay. Medicare also consists of 4 different types of coverage. Part A and Part B, which is what is considered the original Medicare. It also consists of a Part C and a Part D, which we will not discuss in today's video, but just for informational purposes, Part C is the Medicare Advantage plans, while Part D is the prescription coverage that Medicare offers. But again, today we will be focusing on Part A and Part B. Again, the original Medicare. Next slide. Okay, so the original Medicare, what is it, right? So we're going to look at what Part A and Part B consist of. So as you can see up on our slide, Part A is known as hospital coverage, right? So that's a member's hospital insurance. So Part A helps to pay for inpatient care in a hospital. So if a person or a member has a hospital admission, for example, Part A would cover it, or for a limited time at a skilled nursing facility, following a hospital stay, for instance. Part A of Medicare will also pay for some home health care and hospice care. When it comes to Part A, a member will be covered in a series of ways when it comes to anything hospital or inpatient related, okay? With regards to Medicare Part B, this would be considered a member's medical insurance. So this portion of Medicare coverage would help pay for services from doctors and other healthcare providers, specialists, outpatient hospital care, home health care, even durable medical equipment, and in some cases, preventative services and health services that aren't covered by Medicare Part A. Okay. So who would be eligible for both of these parts? So for Part A and Part B. So in essence, Medicare was instituted to provide healthcare coverage to folks that are 65 years and older, younger individuals, younger than 65 who suffer from a disability, and for those individuals suffering from end-stage renal disease. Okay, so those that are 65 and older are generally eligible to receive Medicare Part A and Part B if they are a United States citizen or a permanent legal resident who has lived in the United States for at least 5 years in a row. Individuals younger than 65 years of age can also qualify if they meet the citizenship legal residence requirements and have any of the following qualifying circumstances. So if they've been receiving Social Security disability benefits for at least 24 months in a row, if they suffer from Lou Gehrig's disease, also known as ALS, or if they have permanent kidney failure requiring regular dialysis or a kidney transplant. This condition, which is otherwise known as end-stage renal disease, would make them eligible. Okay, so the cost associated with Part A and Part B coverage. So let's take a look at that. So when it comes to Part A, a member will usually not be responsible and not have to pay a Part A premium if they paid Medicare taxes while working during their lifetime. If they did not pay into the Medicare tax, they will be responsible for a monthly premium of up to $458 a month. The good news is that about 99% of Medicare beneficiaries do not have to pay a premium for Medicare Part A since they have at least accrued 40 quarters of Medicare covered employment within their lifetime. Medicare Part A also carries a deductible and some additional charges. So, for example, for 2020, our current year, a member with Part A would still be responsible for a $1,400 deductible per hospital stay, $352 per day for days 61 through 90 of each benefit period, meaning if a member is admitted as an inpatient and is still in the hospital after the initial 60 days, they would start to accrue a $352 fee per day for every day they're there. Okay. Um, since Part A also offers coverage when it comes to skilled nursing facilities, a member will not have to pay out of pocket for the first 20 days, but will be responsible for a $176 daily charge for days 21 through 100 after that 100-day limit. Um, After the 100-day limit, the member would then be responsible for the entire accrued amount. So if they're there over 100 days, they would have to pay the skilled nursing facility whatever their regular fee is per day. Okay. This is all a little different than Medicare Part B. So as we explained, Medicare Part B is a member's medical insurance. Um, Part B basically helps to pay for services from doctors and other healthcare providers, outpatient hospital care, home health care, durable medical equipment, and some preventative care, and in some cases, services that are not covered by Medicare Part A. The standard premium that Medicare Part B charges is around probably $144 or higher, depending on the member's income. So the amount of $144 actually went up $9 to $10 from the previous year for most enrollees. A member would pay a standard premium amount or higher of $144 if, and here are the ifs, if they enroll in Part B for the first time in 2020, if they do not have Social Security benefits, if they are directly billed for their Part B premiums, which means that they get a monthly bill for the premium every month as opposed to having it automatically deducted from their monies, okay? If they have both Medicare and Medicaid pays their premium, or if their modified adjusted gross income as reported on their IRS tax return from 2 years ago is above a certain amount. Okay, so this concludes our review of the original Medicare, Part A and B. I hope you found the video to be informational. Thank you so much for joining and have a great day.